Hi, this is Jill. Thank you so much for joining us today. We are here with Dr. Pradeep Adatrow from Advanced Dental Implant and TMJ Center in South Haven, and thank you for joining us.
Thank you so much
First
for
of all,
having us.
yes.
I'm really honored to be here. Hello, everyone. My name is Dr. Pradeep Adatrow. I'm a board certified dental specialist. I specialize in two different areas of dentistry. One area is periodontal and dental implant surgery, and the other area is prosthodontics. So,
That's wonderful. And let's talk about where you're located because you're here in DeSoto County.
yeah, we are right dead middle of DeSoto County. We are on the intersection of Goodman Road and Getwell. And we are, as you drive towards North Point School, you can see us on the left-hand side. You can't miss us.
In
It's a
South
big-
Haven.
Yeah, it's South Haven. It's a big building.
It's a great city, and I
yeah.
love your building. So you're board certified. What does that mean?
So when a specialist or a dental or a medical professional says that they are board certified, that means that they have achieved their highest level in their specialty or in their education.
Okay.
So to become board certified, it takes rigorous training and examinations. So once you finish all those, then the certifying board will make you a board certified specialist. So that means that you are better qualified to treat your patients or provide better services for your patients.
That's wonderful. So who is the typical implant patient that you see at your practice?
So in our practice, we see a wide variety of implant patients, but most commonly that I see in my practice are patients who are missing teeth. They're not able to chew well, they're not able to smile well, and don't have a lot of confidence left. So these are the kind of patients that usually come to my practice. Yeah.
Exactly. So would you say that implants improve your quality of life then?
Yes, God gave us natural teeth, and their implants are next best thing to what God gave us. So implants, if properly done, they're done right, they look and feel like your natural teeth, and depending upon
And that's
what
what you want.
Yeah, that's exactly. But it's all about how you execute it and what kind of a end result you get. Yeah.
Oh, yeah, definitely. So do you try to save teeth if possible? Because I know that you said God gave us our teeth and we should try to save them, but is that in your practice? Because I know a lot of people worry about that.
That's the most important thing. When a patient comes to my practice, the first thing I do is, what can I do to save this teeth? So in my
That's
case, okay, recently my wife, she had a tooth that had an issue, and but I didn't take it off and place an implant. I did everything possible to save a tooth. You have to save a tooth because what God gave us is very resilient. It can last you a
Right.
long time, and it's the best thing. And obviously, if I want an implant in my mouth, that'll be the last option. I'll try everything possible to save my teeth and then get an implant. Implant is the last option.
That is
Yeah.
so great.
Yeah.
And I'm sure that makes people feel more at ease because you're there for their best interests. So what kind of implants do you offer?
So that is a very good question because implant is actually a small tiny screw that goes into your jawbone.
Really?
It's like a fence post.
Okay.
You put it in your jawbone, you let the bone grow around the implant, and once the implant is anchored by the bone, you can use it to do a lot of reconstruction on top of it. You can do a single tooth on an implant. You can do, if you place multiple implants, you can do a bridge on top of an implant, or if you have missing a lot of teeth, you can have a denture that can snap onto an implant, or you can make a denture that's screwed onto an implant. So implants are like, they're
Incredible.
different. They're different kind of things you can do with implants.
And when they have a consultation with you, you just tell them their options and
Yes.
what you feel would be the best choice.
Exactly.
That's
So we
great.
sit down, we go through all the options, we go through their health, their condition, their smoking history, they have any medical problems. We go through all that and then find the best solution for them.
It's good to be thorough.
Yeah.
It really is. That's wonderful. So how can implants help people with dentures? Because we already kind of talked about it. It's more of a permanent solution than dentures.
That's right. So you must have seen all those funny TikTok videos or YouTube videos where dentures are falling off.
Right. It's very sad.
Yeah, it
Yes.
is when people are flying through, sneezing or coughing,
Right. Or
eating,
eating, or
dentures come out.
Yeah.
And dentures are, a plate, it's a plastic plate that goes into the patient's mouth.
Okay.
Nothing anchors it. It just stays inside the patient's mouth.
Right.
So, whereas when you put implants underneath these dentures and use these implants to help snap on these dentures, it makes this denture more secure. And it's not falling off when you're eating or sneezing or
That's
coughing.
great. So you kind of use them hand in hand, like they work together.
Exactly.
How wonderful
And-
is that?
Yeah.
So when they're in the process of getting dental implants, how long does that take?
It depends what type of restoration you want in your mouth.
Okay.
If you want a single implant to replace a single tooth, it can be pretty fast. It can be done in about 3 months. We can
great.
place the implant in, we can give them a temporary tooth on top of the implant right away, but once the implant heals in 3 months, we can give them a permanent tooth. So if they're
Wow.
getting a dental bridge with implants bridge, again that we can do a bridge right away, we can do a temporary bridge right away, but to give them the permanent, it takes anywhere between 3 to 6 months.
Because you said there's a healing process.
Yes.
And then, of course, your body has to accept it, right?
Exactly.
So you have to make sure that and you give people a list of instructions on what to do
That's
when they
right.
go home, and it's up to the person to take care of their teeth.
Exactly. The key is here, keep it clean.
Okay.
In that way, your body heals.
Keep bacteria away from it.
Exactly.
Right.
Yeah.
That's really important. So what is gum disease? I mean, that kind of goes into it because you have to keep your mouth clean because that all contributes to gum disease.
Gum disease, a lot of people don't realize it's actually chronic infection in your mouth.
Wow. That's scary.
I specialize in that, in the treatments of gum disease, and I have a lot of patients that come to me, and you have deep pockets around teeth with bacteria laden in there, and it's like micro abscesses all around the teeth. So it's chronic. It's a chronic infection. This gum disease is scary in a way because people don't realize that gum disease is related to a lot of different health conditions in the body. Research has shown that gum disease is related to heart diseases and diabetes, and also premature babies, like pregnant women who have untreated gum disease have shown research has shown that they're more prone to have preterm babies. So
right. I read about that. I read
yeah.
that when you're pregnant, you have to go and make sure you get your dental checks every 6 months. It's really
Exactly.
important because you have to make sure that you're maintaining a healthy, just your body is healthy.
Yeah.
So and
Because-
it all starts in your mouth.
Yeah, it all starts in the mouth. It's bacteria in the mouth, right? So bacteria grow. They
Right.
reproduce. It takes us 9 months to make a baby, but bacteria reproduce so fast. Every 10, 15 minutes, you're doubling the bacterial colonies.
Wow.
So there's only so much that can stay in your mouth. So beyond that, whenever blood flows through your gums, or when you take a sip of water, or your immune system takes all these bacteria and bacterial products into your body, and that is the reason why research has shown that bacterial plaques near heart have the same kind of bacteria that are there in the human mouth. So
That is very interesting.
yeah.
So if you go to your dental checks every 6 months, get your teeth cleaned, they can see if it's actually progressed to gum disease, and then that's when they see you.
Exactly. That's when dentists refer patients to me to treat them for gum disease.
That's
Yeah.
good. And then there's ways to treat it that you can just take care of it for them.
Exactly.
That's
Yeah.
perfect. So why is there, what is the option for treating gum disease? Because I know that there's different stages. You have to make sure you catch it.
Yes. So when you have mild gum disease can be treated with deep cleaning. That's
Okay.
what you keep hearing. Deep cleaning.
That's good.
A mild gum disease can be treated
less
with that.
invasive,
Less
yeah.
invasive and things like that. So it's a little bit more intense than your regular cleanings that you get in a dentist dental clinic. But beyond mild, is something that you got to go and treat it more aggressively. That is when we in our clinic we have lasers. We treat a lot with the lasers.
Great.
We put people to sleep, and then we go in.
So you don't feel what's going on,
Yep.
right?
Yep. So the patient is completely knocked off, and then we go in with the lasers around them. We remove all the infected gum tissue, infected bone, or infected tooth surface. Everything is removed with a laser.
Oh, good.
And then once it's removed, we create a healthy environment in that area so that bacteria don't have a place to live and
That's
thrive.
great.
And make it more cleansable for the patient. In that way, the gum disease doesn't come back.
That's
Yeah.
so nice. And what kind of sedation do you offer? Because you were talking about that before.
Mm.
You want to make sure that your patients feel comfortable when they're there, and they're not feeling any sort of pain when they're going through this. Because even me personally, I worry about that. I don't like pain. I don't like needles.
The good option, sedation, in a dental clinic is like there are different kinds of sedations that are offered in dental clinic.
Okay.
So normally, what you hear all the time in dental clinics is like gas.
Sure.
Okay, getting gas. Getting gas is like drinking a bottle of beer.
Okay. So it's like a mild level.
It's a mild level, right?
Okay.
So, and then the next level of sedation you get offered in a dental practice is oral sedation. Oral
Okay.
sedation means they give you a few pills to take 1 hour before the procedure. When the patients come in, they take those pills and they get a little, the anxiety goes away.
Sure.
And it's like drinking like 2 or 3 bottles of beer.
Okay.
Okay.
A little stronger.
A little stronger. So when then the next is like called the IV sedation, or people also call it twilight sedation and things like that. So
Which they actually have to do, put a needle in your arm. And,
exactly,
right.
you put a catheter in your arm and you it's like anesthesia. Okay,
Sure.
it's like moderate anesthesia. So for that you got to be trained to do that.
Have an anesthesiologist there.
You don't need an anesthesiologist because
Okay.
we are trained to do that.
Oh, you have that at your
Yeah.
practice. That's
So
wonderful.
when we
it's
go
all in-house.
Yeah, when we go through specialty training, we go through anesthesia training and we learn how to do all
incredible.
that. So then we administer drugs through the catheter, make sure we monitor the patient, we monitor the patient's vitals, heart rate, how the heart is functioning, and breathing. We monitor all that. So when the patient is asleep, so we make sure nothing goes wrong, and then we put them to sleep, and then we work on them. So when the patients are under, they don't know what's going on in the mouth, and it's a most comfortable way to get dentistry done.
Right.
Yeah.
And that way, it's smooth for you. It's smooth for the patient.
Exactly.
And then they have nothing to worry about. That
Yeah,
is so
yeah.
nice. And what are some ways that you give back to the community, because you've been so involved, and you're DeSoto's Best, which is incredible. 5 years in a row, you've been DeSoto's Best. So you're a staple in the community in South Haven. You really are. Your company.
Yeah, thank you. It's a really it's important to give back to the community. That's what I felt when the community gives so much to you. I feel it's a responsibility to give back to the community, and that's always been there from the beginning with us. It gives you a good feeling, And
Right.
This
You
is
share your
again,
gift with people.
It is, God gave me a gift
He did.
in form of an education, which I'm able to serve the people that are able to come to me and provide them the right services. There's so many people out there that cannot afford to come to me. So when
Right.
but still we can't leave them like that. So whatever I have, the gift that God has given me, I feel like I need to do more. Not
That's
only
so nice of
not
you.
only the
It's
people who come to me,
incredible.
but people who cannot come to me. So we do a lot of things, community events in our practice. We do the Smile Again event.
Yeah, that's your once a year event.
Event.
Let's talk about that, because you
Yeah.
actually work with a local charity, and you
Yeah.
get people in, adults,
Yeah.
and you provide free
Free dental care.
dental care. It's amazing.
Yeah. So we work with DeSoto Dream Center, and it's a wonderful organization.
It is.
And located in Horn Lake. They take care of a lot of underserved people. We team up with them, and then we bring them in. So once a year, we have a bunch of other dentists that work with us.
That is
And,
so incredible.
we
So other
provide-
dentists come together and they
Yes.
help these people
Yes.
too.
It takes a village, right?
It
Takes
does.
it takes a village, and we all get together in my practice. And
They're in
then-
South Haven.
in South Haven, and we provide free dental care. we've done this 2 years in a row, and the last year we were able to provide care to almost 80 patients.
80 people.
Yeah.
Amazing.
We did extractions, fillings, cleanings, and everything, whatever we could do in a day. We have done that. It's such a nice thing to see. So many people have been suffering with pain for so long.
Right.
Could not afford a dentist, could not go to a dentist.
And they weren't even sure probably where to go.
Yeah. And you relieve them of the pain, and you see the happiness in the smile, and you see them cry with happiness.
Right.
It is a very, very nice feeling.
How amazing.
Yeah.
And I know that you've talked about this before. You actually do want other people to join in on this.
Yes.
So how can people do that, and where should they contact you?
So yeah, I would love for all the dentists in Desoto County to get together, and make this a bigger event. If we can make this a bigger event, we can do
Make it a bigger event. That's right.
We can. I want to see this grow. Not treating 80 patients. I want to treat 300 to 400 patients
Wow.
in a day. So, and provide. There are a lot of uninsured and underserved people in Desoto County. It would be nice to take care of all of them. I would love to do that on a bigger level.
That is amazing. And let's talk about where people can contact you and where they can go to your website and where they can go in for a consultation, because I know that you do want people to come in for a consultation and talk about what they need.
So we have a lot of ways that you can reach out to us. Our website, it's advanceddentaltmj.com. That's a way. And when you go on our website, we have you can make an appointment on the website.
Okay.
You can call us, and we also have a chat bot on the website too, where you can chat with us or
answer questions.
And then we can also make appointments through that. Yeah. So we have multiple ways to reaching us. Yeah.
That's perfect. And so when they come in for an appointment and you refer them to what they need, so when does it happen? Does it do like the same day that you treat them, or is it multiple days, or what should they expect?
If it's an emergency, we treat them on the same day.
Good.
Yeah,
Okay.
because I know how painful dental pain is.
Sure.
Seen it enough. In 22 years, I've seen it enough. People do suffer, and either me or my partner, Dr. Patel, we either one of us, we try our best to treat them on the same day if they're in a lot of pain. And if they're not in a lot of pain, we usually are to do procedures. We are 1 or 2 weeks out to do the procedures, but we try to get them in soon. And
that's perfect.
Yeah.
Because usually you work with the local dentists that have referred them to you, so you already know what's going on.
Exactly.
So that's wonderful. So get in, get out, and get everything done. And thank you again for being here and sharing your gift with us. And for DeSoto County, we really appreciate it.
Yep.
This has been Jill, and we have today
Dr. Pradeep Adatrow, and thank you so much for having us on the show. Yeah.